So I am going to start. So let me welcome everybody to the Northwest Wayne Families Against Narcotics July Public Forum. We are excited about the presentation that we have for you today, and I know that this is also being recorded. So even more people than all of you who are with us today are going to be have an opportunity to see our presentation. As you know, the subject is addiction and incarceration. Before I introduce our speakers, though, I'm going to make a few introductory comments, share some information with you, including information about a couple of cool events that are sort of in the works right now. So let me start by sharing some PowerPoint slides so that you can see that. And Rita Dubbull, hi, welcome.
Sorry. Thank you very much. I'm sorry I'm late.
No problem. Could you please mute your?
Yes, I will.
And anybody else who is joining us, I see Diane Hubble. Hi, Diane. If you could just mute for right now so that we don't get any background noise as we're starting our presentation. Thank you so much. All right, let me just let me do a quick share here. All right, can everybody see the what I've got going on here?
Yes.
Yes? Okay. Terrific. All right. So as I said, this is our Northwest Wayne July Public Forum. And I'm sure that all of you who are with us today are familiar with Families Against Narcotics. We're the Northwest Wayne chapter. We started in April 2017. And like many of the chapters, we've been doing our monthly public forums via Zoom because of the COVID pandemic. I am excited to share with you that we will be returning to in-person forums in August. So we're super excited about that. Our public forums for this chapter are the first Monday of every month. Of course, this month we're off 1 week because of the July 4th holiday, but typically it's the first Monday of every month. So that means that our next public forum is going to be on August 2nd. We hold our public forums at the Summit on the Park in Canton. You can see the address on the PowerPoint slide. I will be posting an event on Facebook that gives the details for the upcoming forum on August 2nd. I can tell you that the topic is going to be addiction in adolescence. And we have Dr. Brian Spitzbergen, who's going to be speaking. He's the Chief Operating Officer of Wellspring Academy, which is the first recovery high school in Michigan. So as you noted on the PowerPoint side, all of our public forums are recorded. Those recordings are uploaded to YouTube. So after this forum, if you've heard this information, you're thinking, I want to see what other topics they've presented on, you can go to our YouTube channel at NW Wayne Fan, kind of scroll through, and you'll see the other topics that we have, and you could listen to other public forums if you'd like. So I note on the top of this PowerPoint slide our mission, which is the mission of FAN as a whole, to provide education, resources, and support to families and individuals who've been impacted by addiction. There are 20 chapters of Families Against Narcotics in Michigan. We serve our mission in many of the same ways, but also we do certain different things to serve the interests of our community. One thing that all chapters do is have these monthly public forums. And as I said, ours is the first Monday of every month. Our chapter also has 2 support groups, one of them which is currently meeting in person, the other one which is meeting on Zoom. You can see the information regarding the 2 support groups on the PowerPoint slide. Our grief support group is for individuals who've lost a loved one as a result of addiction. That's the one that's meeting in person in Canton at the PC Alano Club. You can see on the slide the dates, 1st and 3rd Tuesday of every month from 7 to 8:30 p.m. and the address is there as well. Our family and friends support group is meeting via Zoom, and they're having continuing discussions where, at least for now, they're planning to continue to meet virtually, even though it's possible to get together in person. And the reason they're doing that is because they have, over the course of this past year, developed a group that includes many people who would be unable to drive and be able to come to the meetings if the meetings were in Canton. So they're continuing to do it virtually, and the meetings are going really well. Again, this is for family and friends of individuals who are addicted to substances, and they meet the 2nd and 4th Tuesday of every month from 6:30 to 7:30 p.m. The meeting ID and the password for that support group is the same as the meeting ID and password for our public forums. So you can see that on the PowerPoint slide. Another sort of report of an ongoing program that we and many other fan chapters pursue is Hope Not Handcuffs. So in our area, Northwest Wayne County, we are partnering with the City of Wayne and the Garden City Police Departments for our Hope Not Handcuffs program. We are always looking for people to step into the role of angels to help us with this program. An angel is someone who, you sign up for a certain number of hours to be on call, to be dispatched to a police department, either Wayne or Garden City, or to work online to help individuals seeking treatment to access treatment. You're not just thrown into this not knowing what to do. There is training that goes along with this if you're interested in this. And so if you want to be an angel and you want to sign up for training, you can go to the Families Against Narcotics website, and you can see the page there, the Hope Not Handcuffs page, and you'll get more information about the program as well as training dates for angel trainings if you're interested in doing something like this. If you want more information about this than what you see on the website or than what I've said, you can send an email to us. Our email address is on the this PowerPoint slide as well, northwestwayne@familiesagainstnarcotics.org. So if you want to email us about Hope Not Handcuffs or really about any questions you have regarding our organization, you can send an email to that address and you'll get a prompt response. We also have, I think I've already mentioned it, a pretty active Facebook page. The address for the Facebook page is on the PowerPoint slide. We post various articles that are of interest to our members on that Facebook page. We also create events for all of the events that our chapter is presenting. That would include all of our monthly public forums, as well as any other events that we may have going on. So if you like our Facebook page, you do that, hit the like button, then you'll see our posts, right? And you'll see our events, and you can go to our Facebook page to see what's coming up, what our topic is for the public forum, what the the information is about how you can access it, time, date, etc. is all on our Facebook page. Okay, now I've got some cool, exciting new events to share with you. Since we're all more, we're a little freer now with respect to the pandemic, and we can do cool things, we're doing cool things. So first of all, we are having an event to honor International Overdose Awareness Day. We have done an International Overdose Awareness Day ever since our chapter started in 2017. We have in the past done them at Heritage Park in Canton. That's where we've normally done them. Last year, we actually did a International Overdose Awareness Day event on Zoom that went really well, but it's really not what we want to do ideally. We want to be able to meet in person. So we are finally doing that this year. We've already secured the spot in Heritage Park. It's going to be in the evening on the actual date of International Overdose Awareness Day, August 31st. And I've got a saved date note on this PowerPoint slide. We're developing a flyer that we're going to be sending out, and again, posting the event on Facebook that'll give you more information. So if you're interested in learning more about that, stay tuned and we'll be getting more information to you. The other thing we're doing, and this is a first time thing for us, so hopefully it'll go really, really well. We are doing a golf outing fundraiser. So this is going to happen at Fellows Creek Golf Club in Canton. It's going to be on September 16th. 8 a.m. registration, 9 a.m. shotgun start, $100 per golfer. And then there's also going to be sponsorship opportunities. You can see in the little pink box over there, the different types of things that we're going to be doing at this event in addition to just golfing. So it's going to be a 4-person scramble, but there's going to be a variety of typical contests like longest drive, closest to the pin, that type of thing. Prizes, there's going to be a couple of different raffles, hot dogs and chips at the turn, and then we'll have a dinner and a presentation at the end, which will probably be like late afternoon that we'll end up doing that. So it's an all-day event on Thursday, September 16th. Again, this is sort of a save the date notification. We will be creating an event posting on Facebook. We will be creating a flyer. We're going to have a separate web page on the Families Against Narcotic website for this event. I just got notification about 10 minutes before this meeting that the administrative folks, the creative folks at Fan Central, as I call it, have just put together our page for this golf outing. So literally tomorrow, we're going to be sending out a flyer and letting you know how you can register for this event. So we're really excited about it, and we hope that we have a lot of people participating. All right. So with all that having been said, now we're going to move on to the presentations here with our speakers on the subject of, again, addiction and incarceration. And we are really excited with our great panel of speakers and very thankful and grateful that they are giving their time to us tonight to make these presentations. So I'm going to tell you a little bit about each one of these speakers, and then I'm going to turn the mic, so to speak, over to our first speaker, Chief Dunlap, and we'll move forward with the presentations. There'll be an opportunity for question and answer after the three speakers have given their presentations. So first, I want to introduce Chief Robert Dunlap. He is a law enforcement executive with more than 35 years of law enforcement experience. He's currently serving as the chief of the Wayne County Sheriff's Office in Detroit, where he's responsible for day-to-day operations and management of more than 1,000 employees spread across 5 divisions, which includes jails, courts, and patrol operations. Prior to his appointment to the rank of chief in September of 2015, Chief Dunlap held several other key positions within the Wayne County Sheriff's Office, including Director of Jail Classification and Lead Project Consultant for the new consolidated Wayne County Jail project. Chief Dunlap started his law enforcement career in 1986 with the Detroit Police Department. He rose through the ranks to the position of Assistant Chief of Police, and in that role, Chief Dunlap served as second in command to the nation's 10th largest law enforcement agency, where he was responsible for management and operation of all department resources, including more than 3,100 sworn officers and 500 civilian employees. Chief Dunlap has a master's degree in human resources organizational development, a master's degree in liberal studies, and a certification in organizational development from Eastern Michigan University. He also has a Bachelor of Science degree in criminal justice from Wayne State University. So secondly, Stephanie Powell-Bedell has served as the Wayne County Jail Health Services Administrator since 2018. She oversees medical, mental health, and dental programs, serving an average daily population of 1,900 inmates spanning 3 correctional facilities, and that number is pre-COVID. She leads collaborative efforts with the chief executives, chief magistrates, and legal teams to achieve successful outcomes and partnerships, resulting in access to quality patient care and health screenings. Ms. Powell-Bedell has more than 15 years of healthcare leadership experience. She earned her MSN, BSN, and MBA from the University of Phoenix in Macomb. And finally, Jennifer Smith. Jennifer Smith is a master's level social worker and a graduate of Eastern Michigan University. She currently provides mental health services to inmates at the Women's Huron Valley, Huron Valley Correctional Facility in the Michigan Department of Corrections. Ms. Smith has years of experience providing substance abuse treatment to those in the community and for the Michigan Department of Corrections. She's been trained in DBT, and she's facilitated groups and provided individual counseling for a private practice. Ms. Smith has also volunteered at Safe House to provide support for survivors of domestic violence. So that's our esteemed and very impressive panel of speakers. I'm now going to stop sharing and turn the mic over to Chief Dunlap. Chief, let me know when you'd like me to share your slides.
So good evening, everybody. Can you hear me? Okay.
Yep.
All right. So when we get to the point where I'm ready for you to move the slide, I'll just say slide for you to go to the next slide. But I first want to say thank you to you and all the members of FAN. I believe I participated in one of your panel discussions prior to the pandemic about 3 years ago. And is that me? Hello?
I see that Colin R, can you mute your computer, please?
And Christine, I don't think is muted either. And then Galaxy Note.
Yeah, Galaxy Note is not muted.
I'm
right.
muted.
Christine, you want to mute yours?
There's no noise here, but I don't know how to mute it.
Oh, okay. Well, be really quiet then. Okay. All right, Chief, go ahead.
All right. So I'll try to be quick. I know there's few of us. But again, prior to the pandemic, I had the opportunity to come out and sit on one of your panel discussions. And I believe at that time, the focus was on MAT programs. And I had reported to you all back then that, we were looking to start a program here in the Wayne County Sheriff's Office in our jails. And we had actually started the program right prior to the pandemic. And unfortunately, the pandemic hit and a lot has changed since that time. And so myself and Director Stephanie, our Health Service Administrator, Stephanie Powell-Padell, will share a little more about, how that program went. Just have a brief presentation on, things that, I've seen over now 6 years of working here in the Wayne County Sheriff's Office. Presentation that I'm sharing with you tonight. You can go ahead and put up the first slide if you want. You know what?
Are you ready for me to share?
Yes.
Okay.
And so this was, a presentation that I was scheduled to do right prior to the pandemic on some of the challenges and advantages and disadvantages associated with implementing a MAT program in our jail. And I can tell you, we did experience, some of those challenges from the start. Number one, in the Wayne County Jail, one of the major challenges is with staffing. And so, hello?
I'm here.
Okay, something's happening here. I don't know what's happening.
We can still see and hear you.
Okay, great. So prior to the pandemic, we started the program and some of the challenges associated with staffing, location, and then identifying inmates that, pretty much fit the criteria for the type of medication that we were looking to administer in our jail was some huge challenges because, some of the medications required that the individuals be in custody for a period of time before they get an injection. And I believe at the time it was a minimum of 30 days. And the average length of stay in the Wayne County Jail prior to the pandemic for those that were on misdemeanor charges was in the neighborhood of, 17 days for those with mental health issues and those without mental health or substance abuse issues. They were averaging somewhere around 10 or 12 days. And so it was very challenging trying to identify the number of individuals that would fit the criteria. But the next slide will just kind of give you just a little background on our situation. As you can see in that slide, we have 3 separate facilities, 2 downtown and 1 in Hamtramck. And each one of these facilities are, uniquely different. And the facility footprint sometimes create a challenge to being able to implement some of these programs. What do I mean by that? Our jail division 2, which is our oldest jail centered in the middle, was built in 1929. I call it Shawshank. There's very little space. Actually, we have no space in that jail for inmate programs. And MAT is a program. You don't just want to administer medication and walk away and come back the next time it's time to administer. You want to make sure that there's opportunity for counseling and other services to help the inmates while incarcerated. Jail Division 1, designed a little better. It's a newer facility. It's a modular indirect facility whereby the inmates are housed in all 4 corners of the building on about 6 floors there. And the space there is also very tight. However, that is where we have our clinic, our infirmary, and where we also house our mental health inmates. The Wayne County Jail, we often refer to it as the largest in custody or inpatient mental health facility in the state of Michigan because we dedicate 120 beds to individuals that are suffering from mental illness and or co-occurring disorders such as drug abuse. Back in 2017, when all of this was put together, our average daily population at that time. Slide. Can we go to the next one? Yeah. So these slides were just some slides that was taken from a national study on the opioid crisis that we were experiencing in early 2017, 2018. And the reason that I included these slides in the presentation was just to kind of show a breakdown of where in Wayne County we were finding individuals who were overdosing, as we know, which was a very, very bad problem in 2017, 2018. Detroit being the largest city, the county seat, we were finding the great majority of those that were dying from overdoses in Detroit. But we're on this call because you're part of Western Wayne. I'm sure even though Detroit had its problems, we understand the problems that you've had down there as well. Unfortunately, this slide does not do a good job of showing you very well how the numbers were projected across Wayne County. We can go to the next slide. So during that time in our jail, as I started to say earlier, our average daily population was hovering right around 1,790 people a day in custody, and about another 700 on electronic monitoring tether. What's interesting about that is the average population today in the jail is 1,200, and we have an average population of 1,790 out of the jail on electronic monitoring. And obviously, a lot of that is as a result of COVID and some of the things that we learned from COVID about actually who is in jail. The Wayne County Sheriff's Office is probably one of the only sheriff's offices in the state of Michigan whereby the chief of jails or his or her designee is empowered by the court to do administrative jail releases to, one, divert individuals from jail to treatment, or alleviate overcrowding. And I can tell you, overcrowding has not been an issue for us for quite some time. 99.9% of the individuals that we divert from our jail are diverted from jail to treatment. And so how that's changed since the pandemic is now, not only is the chief designee doing that work, but Chief Judge Tim Kinney and Prosecutor Kim Worthy, along with our health service administrator, Stephanie Powell-Bedell, and members of my staff meet every 2 weeks and look at, who's in the jail and see who in the jail might be suffering from, say, a mental health issue or substance abuse issue, making sure that if charges permitting, we move those people from jail to treatment. And so these slides were just used to show a projection of how those individuals were spread across the 3 jails during that time. So we can go to the next slide. And so what this next slide show is a breakdown of the number of people in jail and the number of those that reported as either having mental health issues or general physical health, substance abuse issues. And you can see the number was very close to about 800. Almost half of our population were what we deem a special population in the Wayne County Jail. Special population because of either their substance abuse issue, physical health, or mental health issues. Mainly the mental health and the substance abuse. Slide. This is a slide that, I found very interesting. It gives you a breakdown of, how much the County of Wayne and the taxpaying citizens in Wayne were spending to incarcerate people in our jail. Now, the focus for me in this slide was really that misdemeanor population. And what we found is Wayne County was spending an average of about $10 million a year, roughly, to house people who were basically incarcerated because of misdemeanor charges. We did a very laser focused assessment of people arrested in 2017. And in 2017, there was 25,000 roughly individuals booked in the Wayne County bookings. Of that 25,000 bookings, about 6,000 of them were misdemeanor bookings. But there was also another roughly 1,800 or so, which might be on the next slide. Can you go to the next slide? 1,800 of those individuals, maybe not, that was booked, in the Wayne County Jail were individuals who had never, ever been arrested for anything else before. It was their very first time ever being arrested. 1,717 people, very first time being brought to the jail. What really got us when we drilled down on this number, 82% of them had mental health issues. We didn't really drill down on the co-occurring disorders, but why we believe that was so significant is because, again, 82% of the people arrested for the very first time, probably because of, maybe being misdiagnosed, underdiagnosed, or just, having no access to services or treatment at all. And so working with Chief Judge Kinney and the judges across Wayne County, Prosecutor Worthy, we knew back in 2017, 2018 that, we needed to really take a look at, this population. And in working with the Detroit Wayne Integrated Health Network, we're able to secure a grant where we started a pilot project to focus on those individuals that were being arrested on misdemeanor charges and very low-level felonies who had either substance abuse or mental health disorders. Those that screen them at the front door, and if we're able to identify them at the front door, divert them to treatment. And all of that came as a result of some of what we learned from this data that's before you here. Next slide. Okay, so this is kind of where I'm getting very close to kicking it over to our health service administrator. Working with Wayne State University and several others across the county, we did a study of our population, took a random sample. I believe it was 2017, where for a 2-week period, we did what's called a K6 screening on every individual that booked in. And out of 130 plus people that booked in, we looked to see who, one, self-reported a substance abuse issue or a mental health order. We looked at certainly their criminal history and whether or not they were utilizing mental health services and if they had secure housing. And it was very interesting what we found. Next slide. And so what we found was very consistent with kind of what we already know. And so I just want to read some our findings specifically, and then I'm going to turn it over to our health service administrator to talk more about how we treat those individuals once they're identified as mental health consumers or substance abuse users when they come to our jail. So here's what we found. In that study, 21% of those that was booked in 2017 in that 2-week period in May, 36% were found in need of some subsequent mental health assessment. So we have a process in the Wayne County Jail where when people book in, there's a certain number of questions that our officers ask, and based on how individuals answer certain questions, they may be flagged and sent directly to medical for an immediate assessment or just a later follow-up. And so in this random sample of 137 individuals, we found that at least 36% of those needed a more detailed assessment. Of the 137 identified, almost 2/3, 64% of those who screened positive for both mental health and substance abuse disorders. And that number, we believe, although it was a very small sample, is very consistent with the population at large here in the Wayne County Sheriff's Office. And, you know, we also found that some of the women had higher rates of mental health issues than the men that were incarcerated. And in that sample population, it showed that, which was kind of surprising to us, that opposed to African Americans, whites were 37% of the people booking in with mental health disorders, co-occurring disorders, as opposed to 17% Black and others. And so all of this data, you know, really just confirmed what we have known for a long time in the Wayne County Sheriff's Office, that, you know, we need to look at opportunities to help those while they're incarcerated before they leave, as well as continue the treatment upon release. And so with that, working with the County Department of Health, Veterans, and Human Wellness, which is the umbrella under which our health services fall, we partnered with Wayne State to introduce an MAT program in our jails, as I had reported to you when I was last before you. And we actually brought in a peer who was working the jails, trying to identify individuals that could be enrolled in the program. And although we started quite a few in the program, we unfortunately was not able to administer any medication prior to the program shutting down and the start of COVID. And so with that, opposed to finishing the rest of the slides here, I want to save some time and pass the mic to Stephanie Powell-Bedell and save time for questions.
Thank you so much, Chief Dunlap. Would you like me to stop sharing the slide deck then?
Sure, you can stop sharing the slides.
All right, thank you very much for those remarks. I'm sure there'll be a lot of questions at the end when we have our Q&A session. Ms. Powell-Bedell?
Hello, everyone. To piggyback off of Chief Dunlap and the importance of a MAT program or a substance abuse program in the jails, along with the research that he has, we kind of looked at, along with Wayne State, where are the places that we could most benefit substance abusers? As Chief Dunlap stated, we assess the patients when they come in. We do an assessment. It's really more geared towards the physical, avoiding the physical withdrawal symptoms. But as we all know, addiction of any sort is mind, body, and spirit, and you have to address every single component or it's unsuccessful. As we move towards working with Wayne State, now that we're kind of free from the pandemic a little bit, with fingers crossed, one of the things that we identified is those counseling sessions. That's really important with any substance abuse recovery program, identifying the resources. Are there underlying issues, whether it's mental health or behavioral health? And teaching the patient, if you will, the ability to identify triggers, right? So we can get the body together. That's wonderful. That's something we can do in a very short period of time with, the medications that we have that actually prevents the withdrawal symptoms that can take up to 30 days to get those substances out of your system. That's when the real hard work begins. Identifying the trigger, having places to live, resources, a support system, in AA counselors, or a phone a friend, if you will. Those are some of the things that we anticipate putting into place moving on. So even when, as Chief Dunlap mentioned, our inmates don't stay very long just because of the dynamics of the Wayne County Jail. With that being said, at the very beginning or the initiation of the substance abuse program, we're looking to give all of those resources and flag those patients as well. I'm sorry, I'm a nurse, so I keep saying patients, but flag those people that are suffering with it so that they're not released from the jail until we make sure that all of the key components are actually met. Do you have a mentor or a stable place to go? How are you doing? What resources have we put in place for those coping strategies? That counseling session in the community. There are a lot of community resources that many of our inmates are not aware of, and putting those things in place to make sure that it is a smoother transition whenever the inmate leaves the Wayne County Jail. Wayne County has a lot of things coming up in terms of building, location, the ability to move around a little bit and give those counseling sessions. So I am looking forward to helping Wayne County in that next endeavor, and subsequently just helping our community, because I'm sure we all know someone, family member, friend, who has suffered from addiction, and no one wakes up one morning and say, I want to be a drug addict when I grow up. So we have to give back to our community. Thank you. If there's any questions, I can answer them at the end.
Thank you very much. Really appreciate your remarks. Now I'm going to turn it over to Jennifer Smith, who is with the Women's Huron Valley Correctional Facility. So Ms. Smith, you want to talk about what's going on over there from a substance use disorder treatment standpoint?
Hi, thank you for having me. I'm excited to be here today. So I am going to talk about what's going on in the prison system and the MAP program and the programming that we do there. And I just got to share with you my slides here, so it'll take me a second. If I can, yep, there it is. Hold on. Okay. All right. All right. Are you seeing that okay?
Yes, we are seeing that okay. There we go.
All right.
You can probably put it into, there we go. Yes.
Okay.
Perfect.
Good. All right. So this is just something that I prepared and kind of giving you some knowledge about why we do the treatment that we do. And that's because more than 48,700 inmates are currently incarcerated in facilities within the system. In Michigan, an estimated 72% and 71% of males and 74% of females in the criminal justice system are assessed as having a substance abuse or dependency problem, and 63% with dependency. So that's pretty high, as you see. We also have as you know, there's a growing opioid use in Michigan, and more than 20% of the incarcerated individuals have identified as having a substance use disorder. And those we have found that leave the prison systems are more like 40 to 100 times more to die of an overdose.
Bugging me. I took him outside for a walk.
So, okay. So they,
Hey, someone is not muted. So Lori Zolkowski, I think you're not muted.
Oh, I'm so sorry.
And as a substance abuse therapist, you know, I have seen this where people do, you know, go out and then they relapse because they use, you know, the same amount that they used to use, and then they do, you know, unfortunately have an overdose. So there's some programming that we offer at Women's Huron Valley, which I can gladly say that I've been a part of in implementing this. And the first one is the longer session, which is called ASAT, and that's Advanced Substance Abuse Treatment. And then we have a shorter version, which is phase 2, which is only like a 19-session program. But both of these programs are touching on not only substance use disorder, but also trauma, healthy relationships and stuff. And they're really directed towards women and the things that they are dealing with every day, and why, you know, some of the reasons why they might turn to substances. And that's with some unhealed trauma and things that they have gone through. So we found that that's one of the areas that we pay particular attention to is healing, you know, and healing and trauma is a part of our, you know, we incorporate it into our treatment programs. So that's what they look like. And they're scored based on their, you know, what they have come in for, what type of crime they come in with. And then they're determined which program they have to do, whether it's ASAT or phase 2. And a lot of them, those are like their requirements before they can meet requirements for parole. Okay. So, whoops. Let me try to go back here. Whoops, I went, I don't know how to go back, sorry. So the benefits of, this is our MAP program. So the benefits of our program are to help prevent overdose and have fewer incidents of violence within the prison system, and also decrease HIV and hepatitis C transmission. And they also found, and this is the studies that they've done in other prisons, because we really haven't gotten it up and running at the women's facility, although it is in process. It's not actually in full force, but they found that there's fewer cases of contraband in the prison system also. The medications that are used in the MAP program, I had to do some research on that we're using at the prison will only be buprenorphine, which is also Suboxone, commonly known as Suboxone, and naltrexone, which is also known as the Vivitrol. So, you know, as one kind of gives you that low moderate dose of an opioid, the other one is a blocker. So the naltrexone is a blocker, and you have to be free of all opiates before you can get a shot of the Vivitrol, or you will go through a withdrawal, and that's the 10 to 14 days type thing that you have to go through. And then we make all of this clear to, you know, the inmates that sign up for this program, kind of what that's going to look like. And then during that program, they have to go through CBT therapy also. So it's not just a medication, it's a the therapy, as well as seeing a doctor to follow up with how they're doing on that medication. But right now we're kind of just implementing that, and we have a huge wait list because, of course, there's a high population, you know, that want that treatment. So that's what we're kind of looking at right now. But we're, you know, also we have the shortage of staff that makes it harder for us to implement things like that, because we have to have somebody to evaluate them, and then we have to have somebody do the therapy, and then we have to have the doctors, of course, to, you know, administer medications and you know, do the follow-up. So that's the struggles that we're coming, you know, against during all of that, trying to get it all started. But the programming itself is going along pretty well, like the ASAT and the phase 2. It's just the MAP program that we're struggling getting up and running. Okay, thank you.
All right, thank you very much. I'm going to open the floor now to questions from our attendees for our panelists. So if any of you have any questions that you'd like to ask them, you can either put it in the chat or feel free to sort of jump in. I don't know that there's a hand raising feature, is there? I see I've got you on grid though, so I'm seeing most of you, but maybe not all of you. I see Christine Cadreau has a question, but you're going to have to unmute. Okay, we lost your video, but you're still muted. Alfred, you can help, right? Christine Cadreau, can you unmute her?
Here we go. I got it.
There we go. All right.
Okay, thank you. I have a couple questions. I have a close relative that is taking Suboxone. She's been on it for 4 years because of an opioid addiction, and it happens to be my daughter. And she is 2 months pregnant, and she did have a miscarriage the last time. And number one, I wondered if Suboxone is harmful for an unborn child. And number two, what can we do to get some of these doctors? I know she goes to a doctor north of Detroit. They are from the Middle East. They own their own pharmacy, and it's the only place that she can get the prescription for it. What can we do to maybe help get rid of those places?
So I don't know that our speakers that this is the topic that, that they are, have expertise to speak on.
Well, I know
I
that
know that
they're
we have, I know that we have at least we have a social worker and a nurse here anyways, who may be able to comment on your first question about buprenorphine and impact on, you know, anything else I think would be opinion because it's not really their area, but if our panel speakers would like to take on that question, be my guest to jump in.
All right, if those were not appropriate, I guess I just have one more. It looks like I'm the only one in the Upper Peninsula that is present right now. And I am interested in being an angel up here and working with counseling. I do have part of my master's in alcohol and substance abuse counseling. And who do I contact about getting some of the training up here in the UP? I'm in Sault Ste. Marie.
Well, right now the training is virtual, I believe, for the most part. They may be starting to do some in person as well. And so are you a part of the fan chapter up there?
Yes.
You know what, Christine, I think that maybe can you and I offline have a conversation about this?
Sure, that's fine.
Yeah.
So can I respond to her? If you say there's just one location where your daughter go that gives her the medication, certainly you can make a report because, you know, it's my understanding that every time those type of drugs are filled by a pharmacy or pharmacist, it has to be reported in a database. And so one of the things that we were looking at with the opioid project that I was on was where exactly these people were getting their drugs and to make sure that they're not over dispensing the medications. And so there's probably a reason that she goes to the same location. And certainly if you want to call me offline and give me the information, I can have someone look into it.
Okay, that would be good.
And so
how do I give you my phone number?
I'll give you my phone number.
Okay, thank you.
And my phone number, I'll say it, is 313.
Wait a second, let me get just something to write with.
Okay. And so Stephanie, can I ask you, when
Go
we
ahead.
have women that come to our jail pregnant and we know that they're addicted, if they're on Suboxone, will we continue that in the jail or no?
Historically, we have transitioned them to methadone for our pregnant women is what we use historically. Again, just going, yeah.
Okay.
All right, sir, I'm ready for your phone number.
So my phone number is 313
Mm-hmm.
875
Okay.
70
Mm-hmm.
20.
All right, thank you so much.
And my assistant is going to answer that call. Just let her know we talked here. And if I'm not available, she'll take down your information for me to call you back.
All right.
And we can certainly have someone go and check it out.
All right. And we're involved quite heavily with the Native American community up here. So I wanted to say Chimikwich, which means thank you.
Great. You're welcome.
Uh-huh.
Oh, I wonder if we, if either one of our speakers or we may have someone else in this meeting who could comment on Christine's other question about the impact of buprenorphine on the fetus. I think Ms. Powell-Vidal, your comment about switching them to methadone corresponds to what I understand to be true, which is, you know, methadone is basically another type of opioid, right? An opioid replacement, as is buprenorphine, Suboxone. And if someone's pregnant, you don't just take them off of opioid replacement treatment, right?
Absolutely. The key is to wean off or wean down. To pull it away can actually cause the internal organs to shut down because the difference with opioids is it becomes a part of your body, and that's why they're so difficult. I always use heroin and cocaine as an example. Heroin actually is one of the most difficult drugs to get off of, simply because it becomes a part. You hurt. You go through so much pain about it that it's unbearable. So you want to wean the patient either down or off of the medication, but you don't want to stop it cold turkey.
Okay, thank you.
I have a comment if I could, please.
Yeah, go ahead.
Okay, so my name is Kelly O'Reilly and I'm a co-facilitator, Christine, of our Stronger Together support group. And I would just like to advise you, if you're open to doing so, to join our group. We have a lot of family members there that are going through the same things that you are. I personally have a daughter that has had 2 babies on Suboxone. So you'll get a lot of support and resources from our peer-led group, and we do have a large amount of people that are willing there to help you and support you through that if you're interested.
Yeah, I would be. Can I give you a phone number real quick, or do you want me to take yours?
Absolutely.
You know,
If you want to put it in the chat.
The only reason I
Go
have
ahead.
any hesitation about that is that you all realize that this is on Zoom and it's also being broadcast live on Facebook. And so unless you want your phone number out there for the world, you might not want to be giving your phone numbers out. So,
All right. What is her name again? What is her name?
Kelly O'Reilly.
Okay, Kelly.
Yeah. And Christine, our family and friends support group, I have events for each of their meetings on the Facebook page. So if you were on Facebook, you would see it. And you can also go to the website and you can, you know, click on our programs and you'll see the Stronger Together groups and you'll see where they meet and what the information is. I had it on the PowerPoint slide I shared earlier as well. So before we end the meeting today, I'll pull that PowerPoint slide presentation up again real quick, and I'll run that slide over so you can see the time, the day, you know, the days and the information to join.
All right, thank you so much.
You're welcome.
If you have the capability, you can add in the chat room, click on my name, and you can send me your email address or phone number if you're able to do so.
And your name is Kelly?
O'Reilly, correct.
Okay, got it. Okay, thanks, Kelly.
Hey, Lauren, it's Christine and Darla's. I had a question I wanted to weigh in on the pregnancy. I wanted to ask, I believe it's Stephanie, why would you wean someone who is pregnant off of MAT or switch them over to methadone if they're on Suboxone coming into jail?
Most of our inmates, if not most, all of our inmates that come into the jail, they come in and we don't wean them off. We put them on methadone. So let me make sure that I'm clear on that. They're coming in off the street using drugs. So we usually use the methadone in terms of Suboxone. And we have a clinic that's what they prescribe.
Any reason to do methadone as opposed to Suboxone even?
Well, it's really up to the provider. That's not something that we do inside of the jail. We don't provide it. So we send them to the clinic and what the doctor prescribes. I'm sure there is a history and physical that goes into that because we do have patients that go to Suboxone. A lot of our patients come and they're already on methadone, and we obviously want to continue that treatment.
Okay, I just wanted to make sure it's clear because you were saying weaning and I'm like, wait.
Well, I'm sorry. When I was speaking about weaning, I was answering the question to Christine about the pregnancies, right? And not just withdrawing the medication. So if you had an option to protect the fetus, you may want to wean down, not necessarily off, as the body will shut down. Yeah, hope is that clear?
Yes, thank you, I appreciate it.
Thank you.
Or just stay on it until after they have the baby, right?
Correct. Yeah.
Yeah. So let's see. I think there was a question. Susan Rowe had a question I saw in the chat. She says, for the sheriff, have they ever looked at breaking out the jail population, your K-6 program, to include those 60 and over? When you say breaking out, you mean sort of in terms of the demographics, Susan? Do you want to maybe, yep, go ahead. I was going to say maybe state your question. So I don't know if I read it clearly.
No, you did. You
Okay.
did. I was just wondering if he had his breakdown of ages, and I just wonder if anybody ever looks at that elder population and, if they get, are in the system and their use of opiates and such.
Yeah, yes, ma'am. Certainly, we look at everyone. We don't, just look at it by age. But I'm happy to tell you that the older population receives a higher priority in terms of that review. And so, regardless of age, we look at the individual, but we do put a special emphasis on those that are,
Why?
60s and up. I'm sorry.
Why?
Catherine, did you have a question?
You said why?
Yeah, why focus on the older? I mean, shouldn't you focus on everybody? Because a younger one might need it more than an older person.
So, Stephanie can answer this better than me, but as I started off, we look at everyone, regardless of age. And certainly, oftentimes, there is a younger person who may be in worse shape health-wise than an older person. But generally, the older the person is, and if there's someone that has been recidivating back and forth to jail, their health condition is generally not the best. And so that is why, the focus is just like, we did with the pandemic. The focus was what? On nursing homes, to make sure that we're protecting everyone, but especially protecting them. And so same approach.
Those at higher risk with more comorbidities, which could present more issues for the patient.
Thank you. I have a question for Ms. Smith. So I was just curious, you were talking about the progress with the MAT program, and a couple of times you'd mentioned that it's not quite where you want it to be. And so that made me curious about more information. What do you mean by that? Is it in the planning stage, but has not yet been implemented, or it's only partially implemented, or what?
So the problem is that we have basically 2 staff and a huge wait list because there's a huge population, of course, that are interested in the program. So there's a screening process for one that they have to go through in order to get on it, and then they have to meet with the doctor, and then they can start getting the medication, and then the therapy, and continues. So that's the problem we're having. It's not rolling quick enough that I would like it to be already in process and people are getting it, because I really feel like it would be helpful for a lot of the client, inmates there. And so it's just not moving as fast as I would like it to, or anybody else, of course. It's just that, we just can't get enough people that really want to work in the prison system too, to help, implement that.
So some of the people have it, but not as many as you'd like. It just hasn't rolled out completely, is what you're saying?
Well, it's just, there's a sign-up list, and it's a huge sign-up list, and some people have been seen evaluated, but it really hasn't been implemented yet. Nobody's getting any medication yet. So that's we're just in the beginning stage.
Do you have support groups within the prison, like 12-step groups and that kind of thing there that are in operation, as well as the ASAT program and the phase 2 program you mentioned?
Well, we used to pre-COVID. We don't yet, but we do, of course, ASAT and phase 2 were on hold too due to COVID, but they will again at some point have them, and they're usually inmate driven. So they're usually an inmate is leading those groups.
Yeah. There's a question that I see in the chat that was directed to me to kind of share. So let me ask that question, and then I see another one too. So and basically the question was, I think this applies to both the jail as well as the prison. What work or what you do to facilitate re-entry that will help support recovery? So that would include things like sober living housing or treatment or resources, just looking to see what each, the jail, the prison, what each of them do to try to assist people leaving the prison and re-entering the community, maintaining their sobriety.
Oh, I'm sorry, I forgot to mention that is part of our programming, but usually we make it an actual part of it is a relapse prevention plan that we make a part of our program, both for ASAT and phase 2, and we make them fill out basically what their plan is when they're leaving, what type of treatment they're going to do, where they're going to go live, and we talk with them and we meet with them one-on-one also during those classes to find out if it is a good place for them to go, if it's a sober place, if it's a, healthier type environment. And we make them plan all of that out before they complete ASAT or phase 2, only so that they have that plan to implement. And then if they do need resources, we look them up for them if they don't know like where to get treatment in their county, because these women are from all different, places in Michigan. So we have to look up places for them in different counties, but we do supply that information usually before they're done with programming.
Thank you for that. Same question to Chief Dunlap or Ms. Powell Bedell.
So one of the things that I can tell you in the Wayne County jail system, when we have an individual in our jail that we know is dealing with a mental health or substance abuse issue, we do not release them from our jail without a minimum of a 10-day supply of medication. So they leave the jail with a script, and if they're going from the jail to residential treatment, that prescription is passed on to the treatment provider that's picking them up so that the prescription can be filled to make sure that we cover the gap between the time of them transitioning from the jail to treatment out in the community. Stephanie can tell you more about how that happens on the medical side.
Actually, Chief, you pretty much summed it up. That again, going back to that flagging system, we kind of know the patients. Custody kind of lets us know where that patient's going through, whether it's AJR or what have you. We reach out, our provider tries to do a provider to provider call, but that prescription is filled at the next facility, and it is written on our end to ensure that the transition of care is fluid.
So quick follow-up to that question, then I'll stop monopolizing the questions, everybody. But it's kind of a follow-up. I think I'm not trying to suggest that the burden is on any of our speakers or their organizations on this question, because I think it's not. Do you think that more could or should be done in some way through some organizations, government, what have you, to better support people who are leaving our prison or jail system and going out into the community? Because Chief Dunlap mentioned the overdose rate. I think it was Chief Dunlap who mentioned it, or was it? No, it was actually Ms. Smith who mentioned it on her PowerPoint slide. How much more frequently you end up with overdoses for people re-entering the community because they go back to using. And I'm just wondering if the three of you think that more could be done. If we were to find the resources, could more be done to support people re-entering to help reduce that?
So for me, there's always an opportunity to do more and improve upon, I think, every situation. Certainly, I think, just really across the country, if you will, one of the things that we know that has changed a lot is, treatment for people prior to coming into contact with law enforcement. And those same challenges of, having, there being a lack of services in the community exists when they come back out. And so, substance abuse and behavioral health clinics, certainly, I think strategically placed throughout the community is a help. I don't know if some of you can relate to, there was a time that, we had a Lafayette clinic, we had a Northville hospital. These were facilities that, the police, if we experience someone on the street in crisis, either from drugs or mental health issues, we can take them to Lafayette Clinic to get them stabilized and detoxed. Jail has become those places for most communities across the country. It started here, and I'm just going to say it, when John Engler was governor, closed up, all the mental health clinics. And certainly, how many years have that been now? You look at where we are in comparison to then, the problem is not getting better. It's only becoming more and more challenging.
Thank you for your comments on that. Any Ms. Powell Bedell or Ms. Smith, would you like to contribute to this as well?
Yeah, I think that the problem is in the community, or even before sometimes coming into a facility, is that, because I used to work as a probation officer also, and I don't think there's enough knowledge of people that deal with like substance abuse in the community sometimes, because it's like, we're easy to lock people up sometimes, and it's really, it should be maybe treatment first, or try treatment first, and try several times sometimes before, because really in the prison system, we do have a treatment, but it's not immediate. You have to wait, and it's not long term. So yeah, I do feel like there could be more done in the community, even before they get there and even after. But the problem is just resources, people, and also people that are willing to work in that field, of course, and and sometimes volunteers, that are helping in that area, because they, when they go out, most of them have the parole officer that are trying to help them get, connected with the right treatment, whether it's outpatient or inpatient, whatever they might want. But it's also hard to lead somebody to, to something that they're not wanting to do or willing to do. So we have that too. So I think, but it definitely wouldn't hurt to have more support, I believe, for the people that are struggling, especially when they get out. And that's the main thing that I do stress in my groups, is that make sure you have a support system, and make sure that you're, on day one, that you're going to a meeting, or that you're talking to your sponsor or your recovery coach, or, and I do stress that they should really even have one of those before they leave, have some type of person that you can talk to, because it's within like the first 24 hours and when they find themselves in trouble sometimes.
Thank you. There's actually an organization, another nonprofit organization in Ann Arbor, in Washtenaw County, I think it's Ann Arbor, called A Brighter Way. I don't know if you have heard of this organization. We actually, I think, have one of the principals of that organization as one of our speakers for our forum towards the end of the year. But A Brighter Way's mission is to focus on that reentry point, and to provide people reentering to the community from prison or jail with resources to help them, get a life and not end up falling back. So it's kind of interesting. All right, I do see we have a comment that I just want to, in the chat, that was sent to me.
Hey, Lauren, before you do that, can I just ask a question to the panelists about when they are re-entering? You had mentioned about the peer recovery coaches that are in jail. Do they get released with the potential to have a peer recovery coach? Do you work with any organizations that have?
Oh, yeah. So yes, we do. Here in Wayne County, we are currently contracted with 5 different residential treatment providers: Team Wellness, Elmhurst House, Heartline, Naomi's Nest, and Detroit Rescue Mission. And so All of those programs, I think two of them are community behavioral health certified team wellness, and I believe Detroit Rescue Michigan just received their certification. And they all have peers as well as, you know, a plethora of other services for those inmates that we release from the jail to their facility for treatment.
And if they don't go to their facilities, if they chose to go someplace else, would they still be able to get a peer recovery coach?
Yes, they will. Those,
Nice.
all of those facilities are, you don't just limit their services to people that are in jail. They much prefer to help those that are out on the street before they come to jail. And even there's other organizations that don't necessarily have a contract with the Wayne County Sheriff's Office, but also provide their services, such as Detroit Recovery Project, which is a big one.
That's awesome. Thank you.
Can I just offer, I used to work with Tim Tout. He was a peer recovery coach for our mental health court program, but he worked for Ryan Road Correctional Facility, and they were doing a project where they paired peer recovery coaches with inmates who are being released on parole and help them transition. So there are programs like that. I think the handoff is always difficult for any system. I mean, if it's a hospital handing off to a nursing home, it's always a problem. The handoff is always the problem, and it's where the danger lies. And it's just a really hard problem to solve. Jails and prisons are not therapeutic environments.
Right.
They don't have the space. They don't have the kind of atmosphere you need to treat people, really. So they shouldn't be the ones, that have to provide this kind of thing. But more and more, of course, people end up, in the jails and prisons because of failures in the other aspects of our society. So I think it's a real problem. And I know that Wayne County, has been working on this pilot project with a navigator for mental health issues that's trying to help people. And I think that in the substance use area, it would be helpful as well. But, resources, even a place, within the jail to have these programs, I think is an issue. So just my 2 cents, having observed the system, for the last 17 or 18 years.
Right.
And if
Good
I
question.
could add 3 cents to that, and that was a very good point. It's all about that root cause. And as we know, substance abuse is usually not the problem. It's usually to suppress another problem. And one of the things that we know, and I think Chief Dunlap, basically said it, is that we don't have, and again, probably related to resources, enough mental health facilities, because there's usually an underlying problem, and the drug or alcohol is often used to suppress that problem. And so we can treat the drug abuse, if you will, but if we don't get to the root cause and the treatment for that, we will continue potentially to, have these type of discussions. And so to answer your question, yes, there's always an opportunity to improve, but we have to be honest with what our true challenges are. And we don't have the resources to address people that actually have, underlying mental health or behavioral health issues, and they seek some type of solace, unfortunately, in drugs and alcohol. That's my 3 cents, sorry.
Thanks. So this was a question that was mentioned a little bit earlier in the chat, so I don't want it to get lost before I give the person who asked it a chance to have it heard. Can the individuals in prison and or the jail essentially attend our fan meetings online, or view the fan speakers on the YouTube channel? So, particularly Ms. Smith, you were talking about the limited resources you have right now and the inability with recovery meetings and that type of thing. Wondering whether broadcasting into, showing our speakers, might be one thing to add to what's offered to the people there.
Yeah, I agree with you. They don't have individual access to internet or, so they can't do anything like that themselves, well, at least not, it's very limited. I can say that. So yeah, it would be nice when all this COVID is over and we can have speakers in again. Because right now they're not really letting volunteers in or anyone quite yet. So, but hopefully soon we can start implementing something like that.
Yeah. Well,
So,
let us
yeah,
know. Let us know. Go ahead. I'm
Yeah.
sorry.
In the Wayne County jails, that's definitely a possibility. We do have tablets where, inmates are allowed to use the tablets to do video calls and pretty much just as we're doing right now. And so if FAN wanted to coordinate a time where FAN could zoom in on a particular housing unit and have these type of discussions, I'm sure that's something that we can probably work out. We'd have to do it in a way where staff is present because we, as the lady that was speaking prior to me, we don't allow our inmates access to the internet, but they do have the ability to make video calls. And so it would be similar to this. And we can certainly work it out some kind of way.
Well, that's definitely something I think we'll think about. We'll talk about it with our board, see if we can maybe come up with something like that to help support you and what you're doing. I see Lori Zolkowski has a question in the chat. I think I'm about 9 messages behind now. I'm trying to catch up here. She says, if we didn't incarcerate people with SUD and or mental health conditions, what percentage of people would still be incarcerated?
It's a good question. Unfortunately, there's still going to be quite a few because, the people that we have in the Wayne County Jail right now are not there just because they have a drug issue or a mental health issue. They're there for some very, very serious charges. And those that can be released to treatment, I have to give credit to Chief Judge Kinney and Prosecutor Worthy, and then my favorite judge retired there in Wayne, Judge Mack and her husband. Folks like that are, pushing us very hard here in Wayne County to take a close look at those people. And I can almost assure you, that, we don't have very many, if any, people in the Wayne County Jail that are there simply because of their substance abuse or mental health issue. And I'm very serious about that. Both Judge Max, I'm sure are very, very involved and have been probably longer than I've been in law enforcement almost. And, we take very serious the opportunity to identify and get people help, those that need the help, but also balancing that against, justice as well. This is not a sympathy program, if you will, but it is a compassion program, justice balanced with, mercy and compassion.
Thank you. Catherine's iPad says, I have a question for Mrs. Smith.
I have a question for Miss Smith. Now, when the ladies are in jail, and we know a lot of them are mothers, and some of them don't know how to be mothers, do you have a program to help them to become and when they get their children, to help them to be able to cope with that? I know a girl, and thankfully we had her mother, but was like, okay, you're out. And she had to learn how to be a mother and think her mother was helping her, but there's a lot of people that don't have that. So do you have a program for them mothers?
Yeah, we do have different programs, and some of them are just for everyday life, kind of living, because there are some people that come in and really don't know how to do like the everyday living skills, right? So we do have those programs available. And and it's called like Moving On is one of them I know of. We also have like a therapist on site that does meet with pregnant women that are there to help them, especially if they have to do the adoption or, you know, other things while in the facility. But, you know, as though everything is limited and we don't have a ton of staff. So there's usually like a waiting period, and then, you know, whether you can get into that program or not before you go home sometimes.
In the
So I agree
communities,
with
is
that.
there any like houses that you send these girls to? Like a safe house or a sober house, but with their kids? So, because that's a big problem. You know, they get stressed when they're trying to do their kids in everyday life. And I've seen it.
Mhm.
And so I was just, you know, because we need something for these people.
Yeah, I agree. We don't personally, like in my area in mental health, like we don't personally do that because it's usually like when they leave the facility. But you're right, when I was working in the community, it's hard to find those facilities that will take women and their children. It's usually just women. So I know they're like really rare to find. And so to answer that, it's probably no, it's probably not something that they're able to do most of the time.
Okay.
Thank you, everybody. We're coming up to 8 o'clock, and I did want to just read this comment I just saw from Susan Rowe in case you're not seeing it. Thank you, Chief John Dunlap, for your the compassion you've shown for those inmates in the jails. Also, thank you to both of the women who gave some good information. So I just wanted to share that. And I did miss one question I saw was coming down here, and the person who the name here on it is Brother Rashid, and it says, question, how do you get the client to buy in once released? And what is the strategy to have family understand the recovery is a lifestyle change? Not sure I totally understand the question, but if he's still with us, he can maybe sort of verbally explain what he's asking here. But I don't hear him. Do either of you, any of you want to address that question in any way? Let me just see.
So it looked like he's trying to speak there.
It says still without a mic. Yeah, I see that.
All right. Well, I'll say, you know, one of the things that we know, those of us that have worked in law enforcement some time, or corrections, or healthcare, dealing with these individuals, it's you know, it's a never-ending battle. It becomes a lifestyle. You have to encourage them to never stop quitting, you know, and just to take every day that they have breath and look at it as the first day of the rest of their life, regardless of anything that has happened in the past, yesterday and all the years before. And so, you know, we obviously deal with a lot of people that are in these situations, and you know, a big part of it is, from what I see from my dealing with it, is you have to continue to support them, even up to the point where, you know, a lot of them are going to relapse, fall off the wagon, if you will. You know, I understand that sometimes it takes hitting a wall for them to really change. And those of us that have never experienced what they're going through really can't relate to it. Even though we feel, I've been in law enforcement for 35 years, but, you know, I know even being in law enforcement for 35 years, I really can't understand or relate to what these people are dealing with. I was just on the phone with a guy earlier who his aunt reached out to me, and just for help. You know, he's out in the community. He's on our tether program, you know, complying with the conditions of tether. And, you know, he, you know, shared with me just a lot of pain in his life that, you know, he's been dealing with since a kid. And so, you know, it's those, what do they call them? ACEs, early childhood experiences that often bring some of the people to where they are, probably a great majority of them. And so it's hard for those of us that have never walked in their shoes to relate to that. It just takes special people like all of you that's involved in this conversation to understand and be patient and support them as much as you can.
Thank you so much for those comments. And I think with that, we'll wrap up the questions so that people can get to their lives and we're not keeping our speakers too long. I do want to just give a huge thank you to you, Chief Dunlap, to Ms. Paul Vidal, to Ms. Smith for your comments. They were so helpful and insightful, and I know you're giving us your Monday night. So I really appreciate that. And I know all of us that are listening will appreciate it, as will the people who ultimately watch the YouTube video and are seeing this on Facebook Live. So we have an even bigger audience than you realize. So before we completely wrap up, for a second, I want to share my screen again and show the PowerPoint slide. And the reason I want to do that is because I want to, again, put up our email address in case there's any, the comment that was mentioned earlier where people were asking about how to access our support group. If you have any questions like that, I want you to email us, right? Send an email and we will we'll get the information to you. So real quick, one more time, let me just share that so you have that information. And I'm really looking forward to when we don't do this anymore, and we instead have flyers and things to hand out so that we're not suddenly, not seeing each other, but instead watching a PowerPoint slide. So anyways, here's the address, North NW Wayne at familiesagainstnarcotics.org. If any of you here are again wanting to know what's the access code, the times for various meetings, you can, go there. You can go on our Facebook page. As I said, everything, all of our events, including our meetings, are there, and you'll find them there. And again, our next public forum is in person, yay, on August 2nd at Summit in the Park. And we look forward to seeing you all then. So that'll conclude our meeting for tonight. And thank you all for coming. Looking forward to seeing you on August 2nd. And again, big thanks to our speakers. Good night, everybody.
Good night, all.
Thanks a lot.
Yeah.
Thank you, everyone.
Thanks, Kelly.